OSCE Station. What is the question? You are the doctor in clinic. A 55-year-old male farm worker with long-term silica dust exposure presents with progressive dyspnea and chronic cough. HRCT shows multiple upper-lobe nodules and eggshell calcification of the hilar lymph nodes. The task is to assess the patient and explain appropriate investigations and management. Now here is how to answer. Spoken teaching script. Start by stating the diagnosis and what supports it. This presentation is most consistent with occupational silicosis, supported by the exposure history and the HRCT pattern of upper-lobe nodules, with eggshell hilar node calcification. Then show you can assess properly. I will take a structured occupational history, type of dusty work, duration, intensity, use of PPE, quantify symptoms, dyspnea grade, cough, sputum, ask about smoking, and screen for red flags such as fever, weight loss, night sweats, and hemoptysis. Next, do focused examination. I will check vitals and oxygen saturation, examine the chest for crackles and signs of chronic lung disease, and assess for core pulmonale, raise JVP, edema, loud P2. Then list investigations in order and say what you expect. I will review chest X-ray HRCT findings and order pulmonary function tests including DLCO. Silicosis often shows a restrictive or mixed defect with reduced DLCO, particularly in more advanced disease. Immediately highlight the safety critical step. Because silicosis increases tuberculosis risk, I must screen for TB, symptom screen plus tests per local protocol, including sputum testing when indicated and TST IgRA for latent TB. Now give management as priorities, not a drug list. The cornerstone is removal from further silica exposure and workplace occupational health measures. Provide supportive treatment, bronchodilators if airflow limitation, manage exacerbations, comorbidities, vaccinations, and prescribe oxygen therapy if hypoxemic. Finish with counseling and follow-up. I will explain silicosis is typically irreversible, but complications can be reduced with exposure, cessation, TB vigilance, and regular follow-up with symptoms, imaging, and lung function monitoring. Give return precautions for worsening breathlessness, fever, hemoptysis, or weight loss.